I've been a midwife since 2014. So 2014 to date, you can see how many experience I've gathered. And I remember 2015 at upcountry Yabao, and I had to go there, walk in how to reach environment. It was very, very difficult. Sometimes you walk in the environment, you are trying to deliver some babies, and then you don't know, you don't have access to electricity at that time. Just imagine delivering under the moonlight. You are depending on the moon to give you light. It was terrible there. But then, I don't know whether you have any experience like that before in your professional career as a midwife.
Yes, of course. I'm approximately working for almost 15 years, and I have been in the provinces from URR to CRR, working there as a nurse and also as a midwife. Being at the URR, I can still remember one of my biggest experience I have there, in which also it teach me a lot. I've been there as a general nurse, having an asthmatic patient attack. So it was very terrible. There was no light then in 2014. And also there, I can vividly remember there was no nebulizer. So with the little experience we gathered from the colleagues there, we just managed the patient until the patient was, and we were very happy to do so.
Like before, where you used to have women coming into delivery, where you have face meet and face, you have 3 women in one room.
I work in Bansang Hospital. It's a big hospital where we receive referrals from all the peripherals there in CRR, URR, and even beyond in Senegal. So there sometimes you have admission, you have difficult cases where you will be managing. You have women who are also in labor. You have also ambulances waiting. You see, you are evacuating one patient, the other ambulance also is waiting behind. So it's not easy working in such place, and it was very difficult also with us there.
Yeah. I remember in 2019 when I was posted to Sarikona Mano Health Center, where you have women facing each other, and UNFPA came in and wanted to introduce this partner companionship management, where they decided to be on one cubicle for one delivery women. I think Sarikona was the first facility after Bundu, Montana, and Child Health in this country to initiate such thing. I don't know whether you ever experienced such.
Yes, I did, and I'm very happy. With the help of UNFPA, Serakunda is one of the minor facilities I love most since I came in. I can be very honest. There before, I was saying this, I did not like the facility, let me say it. But honestly, with this new structure they have built, and to help these mothers also to have safe deliveries with their privacy, is wonders.
Madam Gay, what will you say you would like to see as somebody who is working at the Ranka unit, the reproductive maternal unit, adolescent health, child health? What would you like to see at your unit in Serakunda?
Yes, I'm very happy to hear that. Thank you. We want all our mothers to have a positive outcome. That's why we are advocating for all the mothers to register at an early stage in their first trimester, and they have their positive pregnancy experience. And we want more men involvement. It's very important because they are the decision makers. If they help us, we will go through.
So right now, is there any challenges you are facing when it comes to early bookings, when it comes to women coming when they are pregnant? What are the challenges you are facing right now with the community?
Yes, we have so many challenges there. Some of them, especially even the educated mothers, they are big booking late. Some we even register some at 36 in their 3rd trimester, which is not helpful at all, because you see some in their previous pregnancy they don't have any problem, but in their subsequent pregnancy they may develop certain conditions which should be prevented during their 1st trimester, and sometimes their babies also are at risk of having some infection. Also transmissions can be there. So it's not easy. And also we have, we want space also, looking at the Serekunda Minor Health Center, we registered almost 800 in the first, in our first quarter. We have almost 700 patients. And also with the subsequent visit of approximately 3,000 patients seen there. So we want also UNFPA with the help of the also government to help in, to expand that place for us, because women are coming in is a marketplace. And sometimes we want to reduce the waiting time. So with only 2 cubicles, they have been having a one counseling room is very hectic too.
That is at the Ranka unit you're talking about. So your complications, do you usually see these mothers who come having some complication during pregnancy? And if you have such, what do you do?
Yes, we are at-risk midwife, and we prioritize these at-risk patients. We manage them and refer them to Carnivine Hospital. Because we know our limitation, and there are certain criteria also we look at in each patient you register, so that you will be able to transfer the patient to another level for further management and investigation.
So, Madam Gay, what do you think are some of your success story as a midwife to share with people out there who are inspiring to go into midwifery and they are looking up to you? Because for me, I think it gives me joy to be at the doorstep of mothers, welcoming baby, and then looking at mothers from the inception of pregnancy up to delivery. It gives me a lot of joy, and I'm so happy that I choose that profession. I don't know for you, what are some of your success stories that you can inspire the young one out there?
We have been managing a lot of complications, and we have even what we call near-miss cases, in which those complications have been managed until the patients are okay. And it's a joy, and you feel very happy seeing them back with their life and with their family too. So I'm encouraging everybody to join us in Saving Life, preventing trying to reduce maternal mortality and promoting a safe outcome.
Thank you so much. Empowering midwife is very important as the team demand. And as you know that 75% of the workforce in this country is made out of nurses and midwives. So if midwives are empowered to do CS, it's going to be very good. And to do advanced course when it comes to obstetric and gynae cases in this country, nurses need to be empowered, midwives need to be empowered. So the government in partnership with UNFPA can help to empower us. We really love it. Happy International Midwife Day to all midwives out there. We are glad to be a midwife. Thank you.